Clinical Reasoning in Equine Rehabilitation. A report on Dr. Gillian Tabor's presentation at the 2022 IAVRPT Symposium. Sadly, I couldn't get to the 2024 Symposium of the International Association of Veterinary Rehabilitation and Physical Therapy. I have no doubt it was incredible, as always. I will always proudly remember attending this symposium in the USA to present my scientific poster on the effects of equine touch therapy on back pain in horses. Here's my summary of one of the many excellent 2022 presentations. Title: Clinical Reasoning in Equine Rehabilitation, Pragmatic, Individualized and Evidence-Informed Therapy. Presenter: Dr. Gillian Tabor, UK. Evidence-based medicine can be described as a combination of the best external evidence, individual clinical expertise, and patient values and expectations. We have to be pragmatic in our rehabilitation because we don't always have available what we would consider the gold standard. Some challenges therapists face with rehab are reported as compliance, time, environment, owner knowledge and ability, finance, and more. Owners report the same concerns, especially lack of time, finance, and facilities. Another report from owners is that there is a lack of a rehab plan from the vet. Time management is so important. If you have a plan, you can be more efficient with your time. Communication is key. It's essential that the owner understands the plan and that they can have their input into it. Our plan will often move from stable-based exercises to in-hand exercises and then to ridden exercises. It will gradually progress in intensity and developing postural stability and flexibility. Should we progress according to timescales or milestones? If we used milestones, the return to function would be quicker for some horses and slower for others. Box rest is sometimes essential, but we must be aware of the possible downsides, including social and physical effects. There's no research on hand walking. When the horse is turned out as part of the rehab programme, we must make this as controlled as possible. In the early phase of rehab, consider pain management, mobility, passive and active, core stability training, and early strength training or maintenance. Sensory input from massage, grooming, tapping, etc. can be an important part of this stage. Safety is of the highest priority. Teaching in-hand work is worthwhile. We need to adjust our programme to fit the available facilities and the environment. How do we know when to progress? We can look at movement quality and behavioural signs. We must load the system to encourage it to adapt, but not too much. We can increase intensity by increasing speed or changing the type of work, for example collected or lateral or hills. Of course, every horse is an individual, and there are many factors to consider when developing a rehabilitation programme. The plan is to increase the capacity in all directions for all scenarios to build robustness in movement. I'm Sue Palmer, the Horse Physio, specialising in the links between pain and behaviour in horses and focusing on prevention, partnership and performance. I'm an author, educator and award-winning Chartered Physiotherapist, promoting the kind and fair treatment of horses through empathetic education. You can find the Horse Physio on the web, Facebook, Instagram and YouTube. For news, views and exclusive deals, subscribe to my free newsletter.